Mixed blessing. On one hand, older people are wiser and happier, yes, happier than young people. On the other hand, for a minority of old people, mental illness is a major problem. This minority of old people are often affected by dementia, depression, and insomnia. Dementia is a relatively common disorder in old people. It affects about 1% of the general population, but it is present in elderly people and very rarely in young individuals. Yes, many young individuals are very concerned when they forget their keys, they forget an appointment, or they forget the name of somebody they should have known. This is not a sign of dementia. This is something that happens to young people because they are preoccupied with something, because they are inattentive, because their brains, their mind is overloaded. Dementia is only characteristic to old people. Most demented people are in their late 70s and early 80s. Initially, demented people start by forgetting simple skills and tasks they used to perform very easily. Later on, they forget the names of close friends and family members. And by the end, they are unable to perform basic daily skills like washing yourself or feeding yourself. Caring for a demented individual is particularly expensive because demented individuals need full total care, and because they need supervision in order not to get lost or hurt themselves, it is very expensive to care for them. It costs in Europe about 20,000 euro per year to care for a demented individual. Now, we all ask ourselves, what is responsible for dementia? What happens in one's brain so that one gets demented? About 100 years ago or more, a psychiatrist turned neuropathologist working in Germany described the lesion of a woman he followed up who was demented in life, and when she died, he got her brain, and he described the lesion that bears his name today, Alzheimer's disease. It's a lesion consisting in deposits of a protein called amyloid in the brain tissue. Nevertheless, until the 70s, the popular belief was that you get demented as a normal process of aging, or what was called, in popular terms, hardening of arteries. This is obviously untrue, and in fact, in the 80s, scientists have established criteria for the diagnosis of dementia of the Alzheimer type, which consisted in shrinking of the brain, decrease in the synaptic numbers, decrease in a neurotransmitter necessary for memory formation called acetylcholine. The deposit of this protein called amyloid, and the presence of abnormal cells called tangles. Obviously, scientists have decided that if the neurotransmitter acetylcholine is missing, and if this abnormal protein, amyloid, is present in the brain when it shouldn't, either by increasing the availability of this deficient neurotransmitter acetylcholine, or by fighting, preventing the deposition of this protein called amyloid, either way, it should improve Alzheimer's disease. In the early and mid-90s, drugs were put on the market which were able to increase the availability of this deficient neurotransmitter acetylcholine. Unfortunately, those drugs were able to improve Alzheimer's disease only marginally. In the 2000s, a number of clinical trials were started in which drugs able to prevent the deposition of amyloid or decrease the amount of amyloid in the brain were given to patients with Alzheimer's disease. Again, the drugs were found not to be effective, if at all, to be toxic. So for the moment, our ability to treat Alzheimer's disease is limited. Fortunately, a number of scientific developments have come together to help us in the foreseeable future improve Alzheimer's disease and have a more bright outlook. Turns around that dementia in general and Alzheimer's disease in particular is a multifactorial disease, not necessarily limited to an abnormal protein or to an abnormal neurotransmitter. This is bad news and good news. The bad news, if we have many factors contributing to the disease, like hypertension, like heart disease, it means that we'll have to affect a lot of factors. We'll have to intervene in many ways if we want to improve or prevent Alzheimer's disease. The good news is that many of the factors that increase the vulnerability for Alzheimer's disease are preventable. It turns out that all the risk factors for cardiovascular disease, for myocardial infarctions, are also risk factors for Alzheimer's disease. So if we are able to reduce the level of cholesterol, if we are able to decrease blood pressure, if we are able to decrease or to keep our weight normal, that would not only defend us from myocardial infarction, but would also reduce the risk for Alzheimer's disease. Now, in the foreseeable future, we should be able to develop drugs which really address the main problem, the main issue in Alzheimer's disease. The main issue in Alzheimer's disease is the shrinking of the brain, the fact that the brain tissue deteriorates progressively. And what we are able to do nowadays is to visualize the brain in vivo in patients, to visualize the lesions, characteristics of Alzheimer's disease, to visualize the amyloid plaque, to visualize the metabolism of the brain in patients with Alzheimer's disease. So as we develop drugs which prevent the shrinking of the tissue, the deterioration of the brain, we will be able to follow up with radiologic studies the effect of the drugs we give, facilitating by much the development of drugs for Alzheimer's disease. One should expect any time in 5 to 10 years from now to have real therapeutic breakthroughs in the area. Meanwhile, any preventing activity, like controlling one's weight, blood pressure, cholesterol, performing physical activity, staying active, should reduce the risk for the disease. As I told you, the other affliction of old age is depression. One should very carefully try to distinguish between depressive symptoms, poor mood, which is often characteristic of old people who unfortunately lose status, lose loved ones, are affected by many somatic disease, and obviously are not always in the best of mood. This is to be differentiated from major severe depression disease, which is characterized by inability to enjoy anything, by suicidal thoughts, by imaginary complaints of terminal diseases. Fortunately, there exist good remedies, pharmacological remedies, drugs, and non-pharmacological remedies for depression in old age. One should, however, be careful when administering to an old person antidepressant drugs, that those drugs may cause adverse effects in elderly people who are vulnerable to adverse effects. Another very common affliction of old age is insomnia. Old people tend to wake up very often during the night. Fortunately, most of them go back to sleep very easily. Therefore, again, one should be very careful before treating old people with medication, because it is very easy to push an old individual into delirium with the help of the drugs. So, yes, there are pharmacological treatment for insomnia, but one should be very careful and prefer instead to stay awake during the day, do physical activity, and then one should sleep well at night. Thank you very, very much.